So it's a great joy to welcome you to the 2021 inaugural Deane-Stone lecture on economic measurement given by the UK National Statistician, Professor Sir Ian Diamond. The title is Ambitious, Radical, Inclusive and Sustainable: How a National Statistical Institute Evolved Through COVID-19. Professor Sir Ian Diamond became the UK's National Statistician in October 2019. He is the Principal Advisor on Official Statistics to the UK Statistics Authority and the Government, as well as the Head of the Government Statistical Service, the Government Analysis Function, and a member of the UK Statistics Authority Board as Chief Executive and Permanent Secretary. Sir Ian, a NISA Governor, was knighted in 2013 for his services to social science and higher education, and has written many reports and scholarly articles. Whilst this is the first Deane-Stone lecture, it follows on from an earlier series of Stone lectures, the last two of which were given by Sir Partha Dasgupta in 2010 and Tony Atkinson in 2008. Phyllis Deane and Richard Stone both worked at NISA during the Second World War, when national income statistics were first being developed as official statistics as part of the war effort to assist in planning and sustaining the war economy. Just as the war brought about rapid changes in national income statistics, 60 years later, so has the current pandemic. The ONS has had to adapt rapidly to the pandemic to ensure that economic measurement not only remained of high quality, but also became faster. It has also extended its coverage to measuring the pandemic itself, for example, with the COVID-19 infection survey. The achievements of the ONS in this respect have been, in my opinion, not bettered anywhere else. I'll just say we will be having a question and answer session at the end, so you can put your questions in the chat. It is to this story of the development of statistics during the pandemic that we now turn, and it's over to you, Sir Ian.
Hey, thank you very much. It's an enormous privilege for me to be here, and just simply to say that not only to give the Deane-Stone lecture, but also as a young academic, which was many decades ago now, at the University of Southampton, I was always incredibly impressed and read so much of the work that came out of NISA, and so it's an enormous privilege for me personally to be able to give this lecture this evening. Next slide, please. And also the fact that it is to Sir Richard Stone and Professor Phyllis Deane, who really were, in my opinion, pioneers of economic measurement, and certainly people whose work I was advised to read as a student at the London School of Economics, and I can report that I did certainly read both of their work, both as an undergraduate and indeed as a master's student. Next slide, please. And what I'm going to talk about today is the way in which the ONS has really moved at pace over the last 18 months to really be able to provide what I believe the National Statistics Institute should be doing, which is to bring really strong, trustworthy, accurate data on the economy and indeed on society and the wider world to the service of all our citizens, but also to the service of government in enabling better policy to make the lives of all our citizens better. And in talking through the work of the last 18 months, I think it's important to say that we build on some strong foundations. Next slide, please. Because I think if we go back historically to the later part of the decade before last, with the great financial crisis, at that time producing GDP on a quarterly basis, I think it would be fair to say that ONS was not able to spot the churns and was criticised at that time, rightly so. I would like to really acknowledge the great work of Charles Bean in the Bean report of 2017, which I think really set up a kind of standards and a kind of demands for better and faster economic data. And while you may think that monthly GDP is still perhaps not daily, would that be sensible anyway? But the fact that we were then from 2018 able to introduce monthly GDP, I think has been very helpful in charting the course of this pandemic. I would also say that the fact also through the Bean review that it recommended the building of the Economic Statistics Centre of Excellence, and the fact that we were then able to get the partnership with ESCO through NISA has been so incredibly important. And I've just put on the right hand side of that slide some work that we are very, very, very proud to be associated with, and that's the nowcasting of regional GDP, which again enables us to be able to understand what is going on across our nation in a way that is incredibly important to policymakers, both at a national and a subnational level, and of course across the four devolved administrations. And pretty easy to see how 2020 Q1 things were not looking too bad. 2021 Q1 things not so great, and I think it's important that those foundations have enabled us to build over the next little while. Next slide, please. What I'm going to talk about is now how we responded, and at the time of our response, at the time of the pandemic starting, we were just developing a new UK Statistics Authority strategy, and David Norgrove was very keen to entitle it, absolutely rightly in my view, Statistics for the Public Good. But underneath that strategy were four pillars: ambitious, radical, inclusive, and sustainable, which have been, I think, the really key elements that have driven our thinking as we go through the last 15 to 18 months. And I'm going to talk to you about some of the things that we faced. Next slide, please. In so doing, we needed, firstly, I think, to acknowledge there were questions, conceptual challenges that we needed to face. For example, do furloughed workers count as unemployed or employed? Do children learning from home count towards output in GDP measure? Is the coronavirus job retention scheme a subsidy, a transfer, or government spending? These are conceptual problems that we were faced with. But at the same time, I should say that in doing that, we were also doing everything I'm going to talk about now, working rapidly from home and trying to deliver business as usual. And during this period, I'm really proud that we were able to introduce double deflation into the Blue Book, so that business as usual was going on. But next slide, please. At the same time, we needed to recognize that there was much needed from the government in order to be able to make policy quickly. And I'm going to take you through three surveys that we set up very, very quickly. And people sometimes say that National Statistics Institutes are wonderful things, but they're a bit staid and steady. And the argument I'd like to make is, in this case, we absolutely weren't. So very, very clearly, at the beginning of the pandemic, we needed to know what was going on in the economy and what was happening to business at a time when this was changing very, very quickly. And so we set up our Business Insights and Conditions Survey, BICS, and this survey, which goes out to a sample of around 39,000 businesses and gets a very good response rate, has been going out now on a 2-weekly basis since the early in the pandemic. I haven't got the full list of slides here, but what it's been able to do, and here just some questions and a time series on responses to how long do you think your cash reserves will last, and you can see that the middle of those three lines on the left hand side is 3 months or less, and you can see it going up during the autumn, going down a bit now, and on the right hand side again 3 months or less is the dark blue, and we're able to subdivide that into different sectors of the economy. I've just given you these examples, but what has been really good in a very much one government way is that we have worked with Department of Business, Enterprise and Industrial Strategy, the Treasury, all right across government, to bring new questions in and to respond as time went over. And I'll come back to that in a moment, because I think it is important so to do. Next slide, please. But at the same time, business, of course, is important, critical, but we also need to get the opinions of citizens. And what we did set up right at the beginning in March 2020 was a weekly opinions and lifestyle survey. This is a sample, nationally representative sample of 6,000. Our response rates were over 70%. And it's a weekly survey, so it goes out on a Wednesday. We close it at 4 a.m. On a Monday, and then we publish on Monday lunchtime. So really pacey data. The slide that I show you here is just the percentage of adults who are maintaining social distancing, and you can see that goes down in the period towards the end of the time period. But we've had now over 60 versions of this survey, and again working very closely with government, right across government, to address questions which are important for policy, and doing so in a way which enables us to be able to inform policy. So, for example, we've had questions about face coverings at different times. We've had questions about movement, and questions about loneliness around in lockdowns, around anxiety for the future. So masses of questions, which quite simply you can really only get, I would argue, from a survey of citizens. A lot of talk, and I'll talk a lot about administrative data a bit later, but there are still really important needs in economic measurement and indeed in social measurement for surveys, and here is one that we have used. Next slide, please. And the third survey I wanted to talk about as a reaction is a coronavirus infection survey. Around the beginning of April 2020, I was at a stage meeting, and the point was made that actually we didn't know what the proportion of the population at any time who had the COVID-19 virus was, and it would be incredibly important for decent policy making actually to know that. I have to say, I took a deep breath when I said, yeah, we'll do that, and we'll design a survey. We were able, working in partnership with University of Oxford, University of Manchester, to a man called Thomas House, who has been a brilliant statistician on this, with the Wellcome Trust, Public Health England. We, from absolutely scratch on a Thursday afternoon, designed a survey, got the ethics, got the field work planned, and went into the field in 1 week. And what we do is, it's a household-based longitudinal survey, now taking around about 150,000 swabs a fortnight. And what we do is we take nose and throat swabs from everybody in a household over the age of 2, and we take blood from a subsample of everyone in the household over the age of 12. And that's been incredibly helpful for measuring antibodies. The slide that you have just shows up until last Friday, the trend over time, and you can pick out the autumn and then the big peak on January the 2nd, the drop down, and then the current increase. And in the first part of last summer, we were operating on a smaller sample size, just doing it for England, but it became really clear that these were data which were going to be incredibly important right across the four administrations. And so, as you can see, we started to get data for Northern Ireland, for Wales, and for Scotland, and they are really helpful, I think, in policy making. Next slide, please. But it's not only the positivity that's been important, because as soon as we find, what we do is we take the test and they go straight off to the labs, and if the labs find a positive test, then they go straight for genetic testing. And we were able, in December of last year, absolutely almost, in 2 days, to identify that we were starting to get in Eastern London and in Kent the beginnings of a new variant, and now known as the Alpha variant. And that was really, really helpful and helped us to understand that this was more transmissible and led to that peak that I already just described at the beginning of the year. Again, and this slide shows how in England, Wales, Northern Ireland, and in Scotland, in the period since May, that the Delta variant has increasingly taken over. And you can see a little bit later in Northern Ireland, and in a longer version of this talk, I would explain that. But the fact I think is important is that we were able to understand not only through this survey the prevalence, but also the type of the variant of the virus. And I think that's been incredibly helpful. Next slide, please. But it has also been the case. He said, waiting for the next slide. Can I get the next slide, please? But it's also been the case that we've wanted the surveys to move to address different questions as we move forward. Next slide, please. And an example of this is the real problems around long COVID. And we've used our infection survey to be able, and you may recall that I said this was a household longitudinal study, and that's been very, very helpful in order to be able to follow people up, and has enabled us to make regular estimates, basically 4 weekly estimates of long COVID. And we've worked very closely with colleagues in a number of other groups around the country to not only to make estimates of long COVID, and what we're saying here is 1.5% of the population living in private households will experience long COVID. That's a serious number of people. New study just coming out from us today on this, but we've worked very much with colleagues, for example, at University College London, at University of Leicester under Professor Kamlesh Kunti, and at also University of Bristol, to be able to work to define exactly what we mean by long COVID, and to understand the symptoms. And again, some of the symptoms that you see in that slide have changed over time, particularly with some of the Delta variant, which does seem to have some new symptoms. Next slide, please. And it is not only, I just wanted to show this slide that we put together because I wanted to just make the point that while we've got these 3 surveys that we've put together, which are delivering, the coronavirus infection survey we publish every Friday at lunchtime, the business insights survey published every 2 weeks, the opinion lifestyle survey every week, we also bring them all together. And so, for example, here we've got on the left hand side our estimates of the percentage of adults who'd received 1 or more doses of a vaccine, building over time through to June. At the same time, that's fine at one level, but then you need to know population estimates of vaccine hesitancy, and we were able to get those from the opinion and lifestyle survey, and also to subdivide that vaccine hesitancy by, for example, age or by ethnicity or whatever, which is of course important in terms of policies and interventions to minimize vaccine hesitancy, and then also to link to the views of business about vaccination. So in other words, triangulating around different surveys and using what the different surveys can give us to be able to bring a story around the pandemic together. Next slide, please. But equally, one of the things that Charles Bean's report in 2017 said was people wanted faster data, particularly with regard to the economy, and I think that's really super important. And we did start before the pandemic to start to have a small amount of faster economic data, but we've really radically expanded that in the next little while. I'm going to talk a little bit about that now, if I may. Next slide, please. Next slide, please. And with regard to the economy, what is the consumer doing has been, I think, really important. And here I'm just showing a slide over the length of the pandemic of some work we've got using CHAPS data, and we bring this together with our colleagues at the Bank of England. And the different colours here: green is spending on staples, light blue is spending on, if you like, delayables, and you can see immediately the first lockdown spending went right down, but then people started to spend more. Then on social, that's the bottom line. It took a long time to pick up, obviously, with particularly with hospitality being closed. And then on work related, which is public transport and petrol and things like that, has been, I think, very helpful. We equally use, and I'll talk about some of that a little later, but we equally have access to, we have a partnership with a number of credit card and debit card agencies, and that's been very helpful, for example, in understanding online and in-person spending as well, and I'll talk a little bit about that a little later. But understanding what the consumer is doing is, I think, an important part of understanding the management of the economy, and I know that our colleagues at the Treasury have found this very helpful. Next slide, please. But equally, we use some work from a company called Springboard that we work with, and this gives us retail footfall. And we get that on a daily basis and produce it. And you can, the vertical lines here, the sort of lighter vertical lines, are announcements about lockdowns or restrictions. And you can typically see the impact of those. But I think understanding, again, daily retail footfall, incredibly important. And the bottom slide there splits it between the high street, the retail parks and the shopping centres, and the message very clearly is that retail parks have held up better than other places. Next slide, please. And thirdly, to use traffic cameras. We use traffic cameras everywhere. We've got thousands of traffic cameras that we are able to access data from, and we get those, then we zoom it up into our data science campus, which is brilliant at all kinds of big data related work. And so this is just for London, but I could show you these for just about anywhere. These are divided up into cars, trucks, and pedestrians and cycles. And what you effectively see is everything being down for a long time in London, but picking up from about March, April onwards of this year. And I think it's worth saying that pedestrians and cyclists have picked up. I can show you some more of these kind of things. It's very, very interesting in understanding the movement and mobility. We've also used telecoms data to do some of this as well, and I think it's again interesting work. But I think the traffic cameras work has been very helpful. We also have work where we link traffic cameras with GPS data on ship movements into ports to understand trucks leaving ports, and that's been helpful not only with regard to economic measurement with regard to the pandemic, but also with regard to the end of the transition period. Next slide, please. And vacancy data, incredibly important. And here we have worked with Azuna, which is an online job advertisement one, to be able to get, if you like, real-time data. The three different lines you have there are 2020, 2021, and sorry, 2019, 2020, and then we've got the line that doesn't go obviously right the way through is 2021, and what that shows is the steady increase in demand and vacancies going up, and we're able to use these data alongside other data that I'll talk about in a minute to when we actually say that vacancies are now at their highest level than higher than pre-pandemic level. So next slide, please. And finally, I just wanted to mention this one as well, which I mentioned mobility, and I think it is important. Again, we started using Google before Google, so to speak, using just searches on Google Place, which we could web scrape with their permission, and to do so around particular places. And what you see here against a baseline from pre-pandemic times is real drops in terms of retail and recreation. You see parks hold up a bit, go down and hold up a bit, and you see the increase in the bottom right in residential movements. So it's interesting. Google produced, we were able to web scrape them, and then Google have actually do them internationally now, and I think it's really, really super helpful. Next slide, please. And just, I'm not going to go on to these, but we use, for example, Open Table to understand dining reservations. We have a fantastic. We put together an anxiety basket of goods early in the pandemic just to monitor some of the buying that was going on, and we were able to follow week on week prices for things like tinned soup or hand sanitizer. So, for example, early in the pandemic, I could have told you that the only place you could get hand sanitizer was in Wick in the north of Scotland, and we were also able to notice a crash in the price of nappies in the same week as the Prime Minister had his baby. No correlation there, certainly, but no causation. And we also look at the number of daily flights and track those very, very carefully. So a whole set of real-time indicators which can be brought together in order to inform policy around the economy, but to understand how the consumer is reacting, what is going on the high street, how hospitality is reacting, and how people are responding in terms of travel, for example, to the restrictions that exist. Those kind of things and many more have, I think, been a really rapid response to the pandemic. And I will say this at the end, but I mean, we're not going to stop doing this. It seems to me that real-time indicators are what people are going to want to understand what's going on in our economy, and a National Statistical Institute such as ourselves should be producing this and doing so in a way which is accessible and increasingly available for secondary research by anyone who wants to. Next slide, please. Well, and then I just also wanted to say a few words now and to talk about what we've been doing in order to continue to produce reliable, effective, official statistics, clearly at a time when we were challenged in many ways, not least, for example, if you take our labour force survey relies on initial contacts with our interview with a fantastic field force. Our field force going to people's houses and going inside. Clearly, one of the first things we had to do at the beginning of the pandemic was to pull our field force out. That field force on the labour force survey, we also had to pull out the field force that went into independent shops in particular, in order to be able to gauge prices and hence to influence inflation. Next slide, please. And so we really have made an enormous amount of use of administrative data. And in particular, we work very closely with our colleagues at HM Revenue and Customs, HMRC, in order to be able to use pay-as-you-earn real-time information to be able to access those data in a way which means we can understand the labour force. And so this slide on the left-hand side gives you seasonally adjusted payroll employees right the way through from 2014, going up steadily, nipping down at the beginning of the pandemic, obviously, and then coming back up. And then you can look at percentage change on the same month in the previous year across the different regions of England and across Wales, Scotland and Northern Ireland, and see similar trends. And these have been incredibly helpful to us in enabling us to better understand both the demographic and the distributional impacts of the pandemic and of the restrictions on the labour market, particularly when we had some challenges with from the labour force survey. Next slide, please, on our response rates. And I just want to talk a little bit about what we had to do with the labour force survey. What we had to do initially when we had to come out of the field was to move to both telephone and to online. And in so doing, what we observed pretty quickly was that we had now too many, basically, people in the sample who were owner-occupiers. So it's a problem, obviously, with moving to telephone and to telephone and to interviewing, that we basically brought this bias in. So what we had to do was we brought a new set of weights in, and we made a set of weights based on tenure, and that gave us a new set of estimates with a new set of weights, which I think more better represented what was going on in the labour force. I think it's incredibly important. One of the things I was very keen on, I've always, for my life, believed in open science. And one of the things we've done, there's a whole series of notes that we have made available, which explain in, I hope, great detail. I believe it's in great detail, what we've done. And I think it's incredibly important that we have engaged with colleagues in the academic world to get advice. We have also made, if you like, put our working down in writing. And I do think that's important in terms of not only transparency, but also I would hope that you would trust us, that we were doing things that were sensible, and you're more likely to trust us, it seems to me, if we're very clear to everybody with what we are doing. Next slide, please. I also, though, wanted to make the point that everything I've done so far has rather been national or regional, but we have also, I think, really tried to bring some inclusion into what we have been doing. Next slide, please. And the first of this is looking at the impact of the pandemic on the labour market. and this is just looking at some age distributions, and again, using the pay-as-you-earn data, you can see that really it's the younger members of the labour market who are the most impacted. Next slide, please. And also, I wanted to show you this. This is some work we did, which shows the real advantage of being able to link data. So we were interested in inequalities in COVID mortality, and so all we had was sadly death certificates. Now, there's no ethnicity on a death certificate, so what we do is we link the death certificate to census data, and that gives ethnicity. Also gives us some indicators of disadvantage. We further link it to hospital episode data and to GP data to understand whether the person who sadly has died had some comorbidity. So we then do a whole series of multivariate analyses. The left-hand side of this slide is the first wave going up to September 2020. The right-hand side is the second wave. The green part of each histogram is basically the simple mortality for people of different ethnic backgrounds compared to white British, just adjusting simply for age distributions. We then model to adjust for the disadvantage that exists but within those communities, and what we show is that you reduce a lot of the excess mortality, but you do not reduce it all. In the first wave, there is a higher mortality remaining amongst Black African men. The second wave, a higher mortality amongst people of Bangladeshi or Pakistani heritage. We believe now that this points to further analysis that we need to do, particularly around occupation, particularly around other areas. But I think it's important that to show that we are linking data properly to understand the inequalities that exist, in this case, in COVID mortality. Next slide, please. And I think it's really important, I said right at the beginning that I believe the National Statistics Institute has a responsibility to all its citizens. And we've tried to publish, next slide, please, in an accessible way. And we've really tried extremely hard to use really good visualization. This is an example of pay-as-you-earn data, but good visualizations and good briefings. And the bottom line is we have had enormous numbers of visits to our website. We do see ourselves now as having a real responsibility to continue to help to improve data literacy across our nation, and one of the ways I think we can do that is by continuing to get great data visualization, but also to be able to use the examples that we have, which are so relevant and so engaging for people, to use those in a way that can be used by teachers right across the educational spectrum as a way to encourage and to attract people to the understanding data in a better way. Next slide, please. And then finally, I'm just going to say a few words about commercial data. Next slide, please. I'm not going to go on this at length, but just to say it was an interesting challenge measuring inflation when there aren't any shops open. And so the left-hand side is a decision tree that we were using. In other words, we can't buy it now, but would you normally be able to buy it? And then we had imputation. We were using web scraping. We were using telephones for independent stores. And I think we managed, to get some some really quite useful data on inflation. Next slide, please. And also, we again used help from Barclays and from Revolut to weight tourism data, and that helped us to weight inflation data. And you actually end up with a pretty reasonable estimates. Next slide, please. And all this is available. And I just wanted to say a few words about measuring GDP during a pandemic, because you've got a challenge or two with, as I've said earlier in this talk, you know, what do you do with education? What do you do with health? Next slide, please. And so we started to use alternative data sources. So, you know, question, you're working from home, teachers are working from home. Can you calculate, if you like, the full-time equivalent of teachers working from home against the proportion of the instruction that's dependent on the teachers, not on the parents? We used some data that come from an app called Teacher Tap, and then we were able to inform a discount for education that we applied to all remote learners, and you can see the discount is less for secondary than it is for primary. But I think, you know, what it does is I do think we were ahead of many other countries in really trying to understand the impact of the lack of education on GDP. Next slide, please. And I mean, also just to say, we put a lot of work into understanding health, and you might think, well, hold it. Health surely went up. Hospitals were full, but of course, many elective operations didn't happen, and so actually, you see there was a reduction in health delivery at a time when the pandemic meant that the National Health Service was doing such a wonderful job in protecting us. So where do we go from here? The first thing, I just wanted to say a few words. People say to me sometimes, you know, you've been doing an enormous amount of work informing government. Doesn't that impact on your independence? And actually, not at all. I see no distinction between relevance and independence. We will continue to be at the centre of policy discussions and informing public debate. To do that, we will talk to government, we will talk to stakeholders, we will talk to the public about what is important. But I can assure you that the methodologies we will use, often working, I hope, continue with ESCO, the methodologies we use and the statistics we calculate will be trustworthy and completely independent. And as I say to my colleagues very often, the numbers are the numbers. We will continue to embrace new data sources. Some of the data sources we've used here, I think, have been really super exciting. We are going to continue to embrace them and really have fast economic indicators, while at the same time continuing to deliver the things that, of course, you would want us to around inflation and GDP and the labour force, but often, you know, maybe using new sources to be able to get better and more accurate estimates. And an example of that is some of the things that we have been doing recently, working with HMRC to improve our estimates of migration. Next slide, please. And so finally, we will continue to do the surveys, we'll continue to use retail information, but just finally, I did want to say to you, just as a final point, we will continue to develop sustainable partnerships with people like NISA and with the public and the private sector organisations. We have recently, we await the results from our Inclusive Data Task Force, which will require really exciting partnerships with civil society organisations, and we will continue to respond flexibly and at pace in ensuring that we provide data, sound economic measurement for the public good. Thank you very much, and I'm really looking forward to a good discussion, as I would expect from colleagues at this forum. Thank you.
Well, thank you very much, Sir Ian. A fascinating talk, breathtaking in its scope, really. We could have spent half an hour on some of those slides very easily, but it gave a wonderful overview. I'd just like to just kick off and just focus on one particular aspect, which is the real-time data. Now, the real-time data is, of course, very fascinating, but it also brings with itself problems. Firstly, the understanding. You said it helps us to understand policy, but it can also be a bit confusing, and I think, too many bits of data can confuse the general public and policymakers. We need to provide the understanding. There needs to be a way of aggregating or putting the data together. And secondly, the old thing, I'll just repeat it, but I'd like to hear your response. Real-time data can be misleading. It's very noisy. We all know from GDP, it ain't over till it's balanced and all that sort of stuff. So how would you respond to those issues?
Really, really important points, and that's why we're not about to give up on producing GDP on a monthly basis. Having said that, I take your point that particularly administrative data, one of the things that I think people sometimes think is, it's administrative data, it must all be completely correct, it won't be subject to any measurement error, it won't be dirty, and we can just push forward. Complete nonsense. Administrative data has as many problems as other data. On the other hand, if you work with the kind of brilliant economists that exist at NISA, there are all kinds of ways of looking at fast time series to understand and to bring out the underlying trends and to bring out the important issues. And I think I would rather face those problems head on and work in partnership, as I say, with colleagues at NISA and other academic institutions right across the UK, to really understand what are the underlying trends and what are we really getting from these data. And I do think there's more that can be done. I think it's a really important point for us to really understand those people who are in precarious employment, or who are maybe operating in a number of jobs, and to be inclusive. And I think we get some of that information through the real-time data, and we need to pick that out and to be able to use it as best as we can. So completely get the point you're making, but I actually think that if we work together, we can get the underlying data, we understand the measurement error, and really get the benefits from these data.
Let's hope so. So I'll just move on to some of the questions we've been given. There are quite a few, so we'll work through. So this is from Hector Calvo Pardo, and he says, do the surveys include questions on expectations? I think this was referring to your talk about the business surveys, but it could be any of the surveys. Do they include questions on expectations and preferences, and in addition to behaviour and attitudes? And is the data available?
Yeah, but 100%. I'm really, really super clear that in a world where we can access good administrative data, we need to also worry a lot about respondent burden, and we should ask people questions on surveys that we can't get from somewhere else. And so, and expectations is a really critical part of that. I think I mentioned business sentiment. Is that it seems to me you only get those kinds of data from asking people in surveys. And so, yes, we do ask about expectations, and we ask over time. Are the data available? 100% yes. We have a secure research service, which we work on both ourselves and in partnership with the Economic and Social Research Council, where any bona fide researcher can have access to our data, and indeed many different data sets from across government. And they're available in a very easy way, and you have to just go through a short training course, and you can be accessing the data in 2 weeks.
Thank you. Another question is from Melanie Lerman Royal. She was looked at the chaps and so on, and she was wondering whether it might be possible to increase the depth of chaps and traffic camera data by providing this with more geographic variation, and whether you see the linkages between the census or Celsius census panels with HES or NHS data as a priority for the future.
Yeah, Melanie, what a very good question, and I completely agree that's what we need to do. In fact, what we are doing, because I do think one of the key issues at the moment is understanding inequality and accepting that inequality is both at an individual level, but equally at a spatial level. But those spatial levels need flexible geographies. So, for example, Chris Whitty today put out a piece on coastal towns. And if you look at Blackpool as a whole, you would see that it was, middlingly disadvantaged or advantaged, depending on whether your glass is half full or glass half empty. But within Blackpool, there are areas that are really deprived and areas that are quite wealthy. And so you need to be able to get to sub areas. So what we're doing is we're working closely with Ordnance Survey to get flexible geographies where more or less, we're not there yet. I'll tell you what we can do in a second, but we want to be able, you basically can, if you like, draw your own geography and get a whole set of data for them. Where we are at the moment is a bit before that, but we've taken a kind of booking.com approach where you can filter against disadvantage, against the labour force availability in a particular area. You might want to say, is it within 30 miles of Birmingham, or you might want to say, is it a town of 20 to 30,000 people? And we can do this, and the ability to do that, we're quite happy to make available, and it is something that I think we will continue to do. And what we intend doing is linking health data and economic data, and where we can social data into the entire piece, because at the end of the day, we know that, for example, strong labour forces are healthy labour forces, and so bringing the two together is important.
Thank you very much. Another question going to the end of your talk, really, from Joseph Haynes. One of the most radical decisions taken relates to the adjustment for public sector output. You said ONS is ahead of many other countries in this regard, but the issue is that the UK data is no longer internationally comparable. How did you decide to take that step? What considerations were made to reach the conclusion to forgo internationally comparable data?
Yeah, really good question. I mean, a really, really, really good question. And we have put a lot of work into persuading OECD to have a review to get international comparability. It's a difficult decision, but our judgment had to be we'd rather get it right. And so, yes, we sacrificed some international comparability. I should say that in the pieces we've done on this, we've also done it in a way that maintains international comparability so that we can see the impact of doing this. So for those people who are keen to be able to compare internationally, we can make direct comparisons to see what the impact of doing what we have done is. But at the same time, I do think, I'd rather just get things right, and I believe we've got things right here.
Okay, and something that I know is on a subject dear to your heart, and that's about the new census. Really exciting developments on real-time data. Could Sirian comment on whether this would also affect the production and use of the new census data set? This is from Ying Jin.
Well, thank you. Can I just start by thanking everybody on this call who filled in their census form? It was just an absolute thrill that we've had the best response, I think, well, I don't know about 1811, but certainly since then. A fantastic response, absolutely brilliant. That means those data, when we are finished doing the adjustments we're just doing at the moment, and publishing them, will be incredibly useful, and will be able to be linked in to many of the data that we have talked about today, and will, I think, enable the Secure Research Service to be ever more useful. On the other hand, we agreed in 2014, following a review by the late Chris Skinner and Mike Murphy and John Hollis, that we would do this census now using a digital approach, and it's worked. But at the same time, we would, in 2023, produce a recommendation as to whether you could move to, if you like, administrative data in real time. And we've got a project going on at the moment, which has to report and will report early in 2023. And if I may say, what's the vision here? Well, can I just be very clear, Hugh? I don't know if we're going to get here, but this is where my personal vision is. And that's, we can get monthly population data at basically local authority ward level, and that we will, if you like, be able to say in real time, okay, monthly. I tried to persuade my colleagues for daily, but they said, you can't get people to give you a phone call from the removal van. But so we'll get monthly estimates of population at a local level. At the same time, being able to say to local authorities, this is how many people we think you've got in your area at lunchtime, through commuting, and these are how many people maybe in the evenings and stuff like that, so that we can get serious real-time population data. Now, we think it's just about possible to do that. You're going to ask me, can we? And the simple answer is, I tend to not fully know the answer until I've done the research. So we've got a vision, that's what we're trying to get to. We've got some brilliant people working on it, using multiple sets of data from all kinds of places. And as we become a bit clearer in our work, I can assure you it would be lovely to share it with colleagues, because this is not something we're going to go away into a sort of darkened room and come out and say, yippee. It's going to be a piece that we want to share over time with the community such as NISA.
That's fantastic. Well, that's almost all the questions. I'd just like to finish with one last question of my own, if I may, and that is looking backwards, because I think there's all this data, and there's actually quite a lot of data that's already there, and it would be great to link it all together. I'm a great fan of the postal address file. We've got addresses, you've got the census. A lot of data's there that's been done in the past and that's been done now, can all be linked together. Do you think that's something that the ONS has any interest in doing, or are you more of a forward-looking institution?
No, 100%. I mean, I think, if you look at what we did on monthly GDP, we produced it and then we put the back time series. And I do think, one of the things that I think you really have to do is to do some back time series in order to say you're feeling comfortable about moving forward. And so, Hugh, it would be a pleasure to sit down and have a cup of tea with you and think through some of your ideas, and we can see how we can work together.
Okay, well, thank you for that. Well, I'd just like to take the opportunity to thank Sirine for a fascinating and informative talk. I'd also like to thank all of those who asked questions and all the staff at NISA working behind the scenes. The ONS has done a wonderful job during the pandemic, and it's a really impressive institution. I know bits of it to do with CPI and other things, but it always impresses me, the professionalism of the institution. It's amazing. I'd just like to add that there are some other lectures to come later this year. In 2021, we have the Anglo-German Foundation lecture, Professor Jutta Almendinga. The Price lecture, Professor Sheila Ogilvie. Both lectures will be in November this year. And in February, we also have the 2022 Dow lecture by Silva Tenerario. These are, of course, in addition to the NISA quarterly forecast, the next of which is out in August the 4th, just a few days. But again, I'd really like to thank Sirine for giving such a wonderful lecture, and all of you for coming and taking part. It's been a real pleasure to participate in it and to chair it.
Thank you. Thank you.